One of the things that Springfield is known for is the way this community comes together to address a community need. A great example is the upcoming groundbreaking on August 25th at Cox North for the Alliance for Healthcare Education. This $20 million project is supported by both the state and the federal government. The Alliance, which consists of Cox Health, Springfield Public Schools, Ozark Technical College, and Missouri State University, plans to streamline education for young people who want a career in healthcare. Joining me today to discuss this project is a well-known leader in the healthcare industry. Shallina Goodnight is the Executive Director of the Alliance for Healthcare Education. A 20-year veteran in home healthcare, she has held leadership positions in Oxford Healthcare, which later became Cox Health at Home. In her role as director, she oversaw a staff of 300 people working in 58 counties in Missouri. After an extensive search, she was selected to lead this initiative. Shallina, welcome to In Our Town.
I'm very excited to be here.
Well, thank you. So if you were giving an elevator speech in a few words, how would you describe the mission of the Alliance for Healthcare Education?
So the mission is to be the largest provider of allied health professionals in the region. I mean, this is a workforce development initiative without a doubt. However, I would go further than that. That's what we're going to do. But how we do it is really what makes it special and unique. And I think you kind of correctly alluded to the fact that this is taking education and workforce, both providers and educators, as well as state and federal government, putting them all together and not worrying about previous systems and determining what makes sense for our community, what makes sense for the people that are here, both on the provider side and just people who are looking to improve their futures.
So it's a new model. Is it something that's created out of whole cloth, or did you have some other model in another place that you copied?
Great question. We are the first of this kind in the entire country. There are different areas that are doing pieces and parts of this, but this is the first time that organizations have come together at this scale and created pathways that are this extensive across the board. So on one hand, it's very good because there's no playbook. It doesn't limit us in terms of how we think creatively, but on the other side, there's no playbook.
But that kind of begs a question in my mind. What I understand about it seems like a really good idea. Why aren't other places doing it?
Well, I believe they will. This will be a model that people will absolutely copy, and it doesn't have to just stay inside healthcare. We get calls weekly asking us, how we did it, how we put it together, and I get asked pretty frequently. It is a good idea, and it seems obvious, right? So why hasn't it happened before? It hasn't happened before because, frankly, it took a great amount of courage and trust on behalf of those organizations and the CEOs of those organizations, of our founding partners, to come together in a way that everybody had to kind of lose a little in order to collectively gain. So you had all of those partners that they worked together. Ultimately, they were competing in the education space. So how do you decide to, okay, let's stop competing, let's collaborate, and what does that get us in terms of moving forward? And frankly, that's why I left a career of over 21 years in healthcare leadership. I had no intention of doing so, because this model is so materially different that I truly believe that it is going to transform the way we look at education and we look at workforce development. Of course, I have a heart for healthcare, but like I mentioned before, this doesn't have to stay inside healthcare. You could literally apply it to any industry.
Where did the idea originate?
Well, I wasn't there, so I've heard stories about it, but ultimately it was Cox Health was at the table because Cox Health had Cox College at that time. So you were looking at everyone who was educating in the allied health space.
Now it's up there on North Benton at the original Cox Hospital.
Yes.
Right.
And so a fun fact, the hospital opened in 1906, but in 1907, they started educating nurses. It was the Bird School of Nursing starting in 1907, and it's been continuously running as an educational facility for allied health professionals since then. So it transformed from Bird to Cox College, and yet again, that building is experiencing another transformation to be able to respond to community need.
Well, let's talk about just healthcare in general. Is there a shortage of healthcare workers?
Oh, it's staggering. So I would say another motivating factor, why didn't this happen sooner? Why didn't this happen before? The pain of the problem is now so great that it absolutely eclipses the ability to not do anything. If we don't do anything, frankly, by the year 2032, we're looking at a major crash.
What's created this shortage? I mean, you would typically think if there were jobs out there unfilled that people would, assume they were appropriately compensated, that they would gravitate that way.
That's a really good question. So the first answer to that is just the math. We have baby boomers who are entering stages where they're leaving the workforce and now they're also needing care, and they're simply the
now
number.
Be careful, you're talking about one of them.
Same. We have all of us, friends, family, loved ones, very much entering that area where over time they're leaving the workforce. So that's one part of it, and retiring out of it. And then the other side is we have this whole swell of the population that will need care, and there's simply not as many people to provide it. Now the other part of that, I've worked in healthcare for a long time, but as I've really been able to connect with the community in a different way this past year and thinking about what are the barriers to entering healthcare, what I'm finding is that students, and not just students, frankly, individuals, when they think of working in healthcare, they often think of, okay, I could be a doctor, I could be a nurse, maybe a physical therapist. In reality, any job that exists in the wild, exists anywhere, exists inside healthcare. It really is a city. It's a mini city inside. So helping people to understand that the world of healthcare is so much bigger than simply those three providers. So you can do anything and be anything inside healthcare in terms of the jobs that you see, but also hundreds of jobs that you don't know. So we're really excited about being able to connect that awareness and that sort of hands-on experience to people when they're younger so that they are able to see. Case in point, we did summer school for 7th and 8th graders at the Alliance this past summer, and it was super fun and very immersive. We had one kiddo who was excited about it, and he was like, this is so cool, all the stuff that I'm seeing, but I really think I want to be a pilot. Well, he was really excited when that Friday the helicopters came, and you can be a pilot inside healthcare.
Oh yeah, I suppose that's right.
You absolutely can.
I know the helicopter goes over my house frequently.
Yes. So that's the great thing, is helping kiddos to be able to see, and frankly, it's not just kids, it's again, people, just anyone. If you have a heart for people, if you have a heart for healthcare, there's a place for you. So some of it has been, why are more people not choosing a career in healthcare? Because it is well compensated, it is in demand, it is, in this region, healthcare and education are great industries. So often it's because the view of what you can be inside healthcare seems narrow. So we're really working to change what that looks like across the landscape.
And another sector, I guess I would talk about. You talk about like a continuum of healthcare, and you also see it in education, a continuum.
Yes.
So let's just talk a little bit. My sense is up to this point, it's a little bit like a mouse maze. You might start here, move over here. You run up against a block, you back up, do something else. But what you folks are trying to do is to streamline and be able to create a trajectory for people that want to do it. So let's start. Maybe it's beginning now in high school, right?
Correct.
So paint that picture for us.
This is really, the student journey is actually what ultimately made me fall in love with this organization. So juniors and seniors in high school come to the Alliance, which is a hospital. We just discussed that. And by the time they graduate with their high school diploma. They graduate with either an EMT or a CNA credential and up to an associate degree in bioclinical sciences at no cost to them or their family.
So you're saving them a lot of money out of
A lot of money, and we're accelerating that pathway. So it's important to remember that the Alliance is a workforce development initiative. So that means that the only kind of certifications, degree pathways, and credentialing that we provide are those that end in an in-demand job. So it doesn't matter whether you're graduating with a certificate, a 2-year degree, a 4-year degree, or a graduate degree. The only pathways that are available are the ones that are informed by our workforce that tell us here's what we need and here's what we need today, 5 years, 10 years, and we're building to that. So that high school student now can go, if they want to, directly into the workforce because they've earned credentials. So they can go directly into the workforce and they can be done with their education if they'd like to. We have no pre-prescribed pathway or place that we're trying to push people into. It's an
So they can get a
opportunity for
better
them.
job than driving for Domino's right out of high school.
Correct. And if they wanted to, they could go work for.
Not that there's anything wrong
No, no,
for
no.
driving, but they
There's not.
get my point.
But there is a pathway in healthcare for everyone. If you're not happy in your current job, or if you feel like your job is just a job, healthcare is mission focused. And so there's that ability of connection that because you're right, there are no bad jobs, but there are some pretty awesome careers, and healthcare is one of those.
You know, one of the things that I think is cool about this initiative, as I understand it, when I was a reporter at one time, and I became a lawyer, but you would get exposure to different kinds of things, and you'd say, hey, this isn't for me, but this is.
Yeah, absolutely.
And I think the way I see this is creating a buffet, a menu for these young people to get exposure on different facets of the healthcare industry, you know, and decide maybe what's right for them or what isn't. You know.
Correct. You're exactly right. So it's taking the lid off of allied health and helping people
That's a good
really
way to
see,
say it, sure.
really see what's under the hood. So, you know, two things there. The high school students specifically, they are spending their junior year, in addition to their studies, they're spending a significant amount of time embedded in clinical environments across the continuum of healthcare to do exactly what you just said, so that they are immersed in and seeing real live, here is what happens, here's what it means to do this kind of work. So we call last year Year Zero. We had our first group of junior students because we were just, really just kind of beginning to tiptoe into it. And it was so fun to be able to look at that group at the beginning of the school year. And here, it was about 50% of them kind of had an idea of what they wanted to do. The other 50%, no idea at all. By the end of the year, it was interesting to see what happened. Of those who knew what they came in knowing what they wanted to do, half of that group changed their mind. They were like, actually, I thought that this is what I wanted to do, but as it turns out, I don't like people that much, so I want to go into the lab. I don't want to be bedside. I want to do the science part of healthcare. And then
Well, you saved them a lot of time right there.
Absolutely. And then the other part, so many things I want to say, like how much time do we have? But the other part of the group that was undecided, all of them, but one, all of them found a place they felt they could live in healthcare. The one loved her experience. She's like, this was so fun. I got to see a delivery. I got to all of these things. But she's like, you know what? At the end of the day, I really want to be a choir teacher. And so she went back to her sending high school. That's great. That's a win. All of those things, because I think about my own, experience in the dark ages when I went to school, and I'm a proud Springfield Public School graduate. Go Falcons. But there was not an idea of connection to workforce at that time. Like there really wasn't. And so what I saw at that time, I was like, okay, well, you could be a teacher, you could be a doctor, you could be like, it was just very narrow in a view of what I thought that you could do. And we see that the earlier we can connect kids to workforce, they can dream it, they can see it, they can plan for it. And in healthcare, in this particular situation, we can help them get connected. So they're getting that, so they graduate with all of that stuff that we told you. So from there, they have a really good idea of what it is they want to do and they're building towards. And we've helped them create the pathway so it's seamless. So that person, let's say, she's graduated, she will go work part-time. Let's say she wants to continue her education. She'll go work part-time for a healthcare provider, and being part of the Alliance as a workforce partner or affiliate is that you must invest in your workforce and your students. So that means you can't come into the Alliance if you're not willing to help support students. So she could go work for a healthcare provider. That healthcare provider, as part of the Alliance, they're going to help support her tuition as she continues her education. So she can graduate by 1920, about 2 years later, after she graduated high school, with a 4-year degree. So in this case, let's just say an RN for convenience sake. She could graduate with a 4-year degree at 20 years old, making $65,000 a year, full benefits, and zero debt.
That's amazing. So let's talk about this a little bit. At the end of the day, the organization, the Alliance, the hope is it's going to be more efficient. It's going to save kids money, but everybody had to give up something.
Right.
And so you had except maybe the school system. I don't know to what extent they were. Springfield Public Schools was involved, but you had Ozarks Tech and Missouri State and Cox Health, and there was some duplication. Who's going to do what under this new regime?
Such a good question. So everyone did give up something, and I will start with Springfield Public Schools because out of everyone, they don't have the really obvious gain at the end. So for instance, MSU and OTC, they're increasing their students. Cox Health, they're going to hire these people. So there's an obvious gain for those three. Springfield Public Schools, I am so proud of our superintendent, of our school board, of all of the leadership, and I mean, frankly, just the entire school system is remarkable in terms of being willing to say, you know what, this is what our community needs. We are willing to step in and do this and invest in it because it's the right thing for our community and for our students. So,
well, it wasn't a unanimous decision, though, was it?
I
It's
wasn't
a close
at that
vote.
school board meeting, but I do not believe it was. But it's something that they still elected to move forward with, and I am really appreciative of that.
Well, there were some concerns, if I remember the news article, about just where our focus should be and so forth, although I think everybody, from my understanding, thought it was a good idea. Do you feel like the board as a whole is that was then and this is now and we're moving forward with it?
Yes, in fact, we have great relationships with many of the board members who are engaged, who come to events to learn more, to be part of it. They're really engaging in terms of being active school board members and representing, you know, the interest of both the district and certainly of students. So I have nothing but good things to say. I'm really, really appreciative of how forward-thinking our entire community is, and certainly our public schools. In terms of MSU, OTC, Cox College, how does all of that work together? Who does what? Cox Health agreed that they would transition their college, teach their college out, and then by doing so, that automatically helped to save money. So if you think of Cox College as a private college, the tuition rates were significantly higher than OTC and MSU for like programs, significantly higher. So by doing so, that means that students are not going to be paying those prices. They'll be paying MSU and OTC prices. And then sort of the division of how is this going to work, then OTC is offering certificates and 2-year programs, and then MSU is offering 4-year programs and graduate programs. So that's sort of the easy way that was divided up. But I don't want to say it was easy in that there was a significant amount of mapping, program mapping, accreditation, all of those things that had to be done. But I will tell you, our fall semester is the first semester that we're going to have students on the Alliance campus as the Alliance. And our first year enrollment, just for this coming fall, across the board, is on track to produce more graduates eventually, but has a higher enrollment than the 3 institutions produced independently. So by year 1,
You've
already
already accomplished your objective there, you know.
And we're just getting started. I mean, we're just getting started. So
And you know, I don't think everybody can fully appreciate what a heavy lift this is. Number one, getting everybody to work together, and there's so many people, stakeholders in something like this. And then even if everybody can get on the same page, then you deal with the federal and state authorities and the accreditation, and God bless you folks for having the energy to undertake it. It is a heavy lift.
It is, and I shared that, and skeptical is probably not the right word, but as I started exploring the Alliance and, you know, is this something that would make sense for me to step into, part of the question I had was, you got a lot of people at the table and a lot of priorities, a lot of personalities. This could go south as quickly as it could go well. And so I frankly looked our board of directors, you know, each one of them when we were having conversations, and I'm like, you know, how do you prioritize this in your institution? And if it had been anything but number 1 in any of those institutions, I would have had real concern about stepping into it. But they each said that this is the priority. Workforce development, creating these pathways, doing these new sorts of collaborations in terms of bridging together what have been historically siloed. We're lucky in our community that is the case. And
So who is your boss?
I report to the board of directors. So I report to all of those CEOs and Rob Fulp, who's the chair of our board. So that looks like
So it's the leaders of the 4 institutions plus Rob?
yes, that's my board of directors, and so I report to them. And frankly, the fact that each of those CEOs were willing to serve on a board of a startup, by the way.
It's not like they don't have something else to do.
Correct. That speaks to how important they all see this, and this would not have been. I don't see how it would have been successful had they not been willing to do it, because what we talked about earlier in terms of we needed every organization to step forward and be willing to lose a little in order for us all to collectively gain. That has to come from the top. That has to be the CEO saying, we are going to do this, we are going to think differently, and empowering their teams to give them the freedom and flexibility to make those decisions and think about things differently. Something that came out of it, as I will say, really give so much credit to Dr. Mark Smith and Dr. Aaron Light from MSU and OTC respectively. They were sitting down and mapping programs and pathways from what was Cox College to MSU to OTC to how we were going to sort of all stitch this together. And they found more than one degree pathway where they were able to look at each other and say, is this really what we need? Or can this be done differently? Can this be done shorter? Can this be done more seamlessly? And so they accomplished that by just being willing to take a fresh eye and look at it. Rather, they could have just copied and pasted, right? Take what was already there and just do it, but slap a different name on it. But that wasn't what anyone was interested in doing. We want to elevate the number of professionals, yes, but we also want to change the quality and the way in which we go about educating these people so that they are completely competent and confident as they come into this.
So let's switch gears a little bit and talk about what's happening at Cox North.
It's so exciting. So that is that building, so much history. I mean, it is remarkable that building has been serving the community since 1906 in various ways, shape, and forms. And goodness, we have seen an evolution multiple times, right? Of how that's looking. There is a perception, I think, sometimes that maybe that area is not ideal or just not ideal for whatever reason.
Well, a note to the audience. My wife, she's doing just fine, had to go to the emergency room a few weeks ago. And I have several doctor friends, and she was at Mercy for 10 hours before she actually saw a emergency room physician. I was talking to Steve Edwards. He said it's not a lot better at Cox South on some days, but if you go to Cox North emergency room, the waits are a lot shorter, and if you have to go to the hospital, they can get you right in. And it's the same staff, and it's not a secret. It's a secret that a lot of people don't know.
It's a gem, correct. And so not only are there ways to access amazing care in that hospital, but in 2020, Cox College, who also operated out of Cox North, they completed an 80,000 square foot renovation for their school space, and it is absolutely beautiful. And then Cox Health is a very generous partner, so as part of this, the Alliance, they've given us the ability to expand and utilize the entire building as we continue to grow. So here's the special part of that. We are getting ready to break ground on our expansion. We are so thankful that our policymakers and our elected delegation really saw this and supported it early. We received $15 million from an estate allocation last year, and then another $6.7 million as part of a Strengthening Communities federal grant that was received collectively along our partners as well, and OTC did a great job of really leading that charge. So when you put that collectively together, that's a significant amount, and we are able to expand an additional 30,000 square feet of educational space so that we actually have room to house all of this growth. And here's the cool thing. We are not looking to try to turn this hospital into a traditional school. We already have 80,000 square feet of beautiful renovated space that you would think of whenever you think of a school. We are training allied health professionals And Cox Health gave us this whole hospital. So rather than trying to build more classrooms, we are taking clinical spaces and we are turning those into educational environments. So students will learn while they will actually work. And that is
It's a little bit OJT, isn't it?
Yes. And that is something that is completely unique. So not only is this, this is kind of Alliance 1.0 as we're talking about what we're doing right now, but ultimately this is a regional, meant to have a regional impact to support all of our healthcare workforce and healthcare providers. So this will be something that will be really a beacon for the entire region and ultimately the nation to be able to look at.
How long should it take to complete the renovation?
So we're breaking ground on that on the 25th. Hope you'll join it because this is for the entire community. This is not just for healthcare education because it ties to everyone. We are building this for you, Springfield and regional areas. So it will take 1 year. We're breaking ground on the 25th. We'll be ready fall of 26 to host more students. And so that's kind of been our
But in the
limiting factor.
meantime, they're stepping around the drywall dust and so forth.
A bit. So that's funny to think about. I mean, it's interesting to think about. So we're lucky in that we already have 80,000 square feet of space where our students are learning. And so the additional space is not, it's not in that space, if that makes sense, but it certainly butts up against it. So
Right.
I can't pretend that there's not going to be any disruption, but I'm extraordinarily thankful for the way that our construction and architecture partners, DeWitt and Paragon, have approached this project in terms of being very sensitive to the student experience, to try to phase things during breaks, outside of finals, because there's going to be some disruption without a doubt, but working to keep the biggest parts places when it's not going to be student facing. The other side of this is we're being really transparent with our students and with our team. This is how major healthcare initiatives, education initiatives are built. They're part of it. So we're not, while there's going to be some noise occasionally, they're part of and getting to see firsthand how this is actually taking place and how it's being built. So that in and of itself, I think, is a pretty interesting experience.
So you alluded to this, but let me pin you down a little bit. How many, before the alliance came into being, how many people were moving into healthcare, students, and what do you expect it to be after you guys are up and going?
So that really is dependent by program, and we have 33 different pathways at this point and continuing to grow in terms of allied health. But I can tell you, like radiology, for instance, that has already doubled in terms of what we're producing or enrolled producing. If you think of MSU, they were approved to double their nursing programs year one. So those seats are already full. We are already, just by expanding and having the space to do so, people are looking at this saying, yes, we'll do it. Along with the fact that we're creating this new pipeline of interested individuals through high school, and not just high school. I will say that it is, I don't know about you, but my life did not go in a straight line. Say a plan and God will tell you otherwise, whatever that saying is. There are a number of different people out there in the world who have not reached their full professional potential for whatever reason, both inside healthcare, who are currently working inside healthcare, and those outside of healthcare. Those people too, we have accelerated pathways, we have low-cost pathways, we have help. So you may have someone who maybe would go through SPS, OTC, MSU. That would be very complicated to try to put together on your own. It's overwhelming,
absolutely.
Very complicated. The Alliance is not a degree conferring institution. Those organizations are. You would have had, and all of the pieces and parts existed before, but you would have had to know how to access them. Now we can help. So if you have a heart for healthcare, and I'll tell you this specifically, this is the story I'm thinking of. One of our high school students, at the end of the year, we had just a fun day, and we had some parents there. And one of the parents came up to us and she said, I work at FedEx. Is it too late for me? The answer is no. She needed to know how and what that means. So through our group, we were able to look at, okay, what are you interested in? And walk her through some of those things. Like, here's the salaries of those. Here's how much school it takes. Here are various pathways. And so she can go through all of those steps. And for her, it may look complicated on the background, behind the stage curtains, but in front of the stage curtains, she's just walking across the stage getting her diploma. We've done the
That's,
hard
to me,
part.
that's such a big deal. I talk to people that are thinking about going to college or this, And there just seems to be such a barrier for them to access the information.
Yes.
And lots of times they don't know the right questions
It's
to ask.
confusing. Exactly. It's confusing. And by no, we have great educational, great educational environment here, but it is. It's confusing. And it's interesting. I was lucky enough to go to college. My husband and Marty and I have 5 kids together, and 3 of them, we have one who's going into her junior year in college and 2 girls that are going into their freshman year in college this year. We still have 2 at home. However, we're both engaged parents. We are involved. We both went to college. Navigating this has been so confusing even for us who have experience with it, who have kids who are also engaged and knew that they were going to go. For people who maybe don't have experience in it, it feels impossible. It feels completely overwhelming. And so that's kind of our message, is that any job that exists inside healthcare. And if you have the heart, we can help. We will make it easy.
You know, one of the exciting things to me about this is I think in terms of what makes some communities more successful than others is different cities seem to develop particular expertises. A big example, of course, would be Silicon Valley or New York City, the finance. Here in Springfield, one industry that comes to mind is stainless steel.
Yes.
It started with Paul Mueller,
Uh-huh.
and there's trucking, but the biggest employers in our community are the hospitals and the related businesses and education, and those 2 things go together quite well. And I do think that you can start to build and expand exponentially if you have things that are synergistic.
Yep.
And
Exactly
this is a wonderful thing. It's just starting, but I think it has a lot of potential.
It absolutely does. And we are just getting started, as you pointed out, because this is a regional initiative. So that means Alliance 1.0 is what we're building right now, right? We've got this great opportunity to expand a building, but the Alliance is not a building. It's not a location. The Alliance is this uniting entity to bring people together so that we collaborate and educate and then compete afterwards. So we want every single healthcare provider at the table across the region. We are looking at Alliance 2.0 in terms of how are we going to address regional. So we've got, you think Bolivar or Lebanon. Well, they're close. And maybe Bolivar's close enough that people could come to Springfield. Lebanon's probably not close enough where people are going to come every single day. But those communities are also hubs for small towns outside of those communities where Springfield would absolutely be too far away. So we have to think about how do we utilize our resources? How do we utilize our satellite campuses for MSU,
Right.
OTC? How do we utilize launch virtual learning? And then the clinical spaces that exist inside those communities. How do we create regional hubs so that it's not just Springfield, that we're bringing the experience to the students, because you may have someone who would be interested in it but feels that there's no way. So a barrier is distance. It's that it's simply not available in a way that it would be easily accessible to someone who's just a little bit further away. So this in no way are we saying we're going to build it here, everyone's going to come here, this is where it is. The Alliance is bigger than that, and we are thinking bigger than that, because in order to produce the number of allied health professionals, it's not going to be easy, and it's not going to be doing it the way it's been done. It's going to look at what does a person need and how do we get it to them, where they are, in the best way, and the way that makes most sense for them, accelerated and low cost.
I wouldn't be doing a comprehensive interview if I didn't ask you what would it take to get Mercy to be part of this.
Oh, we've Mercy invitations on the table. We've absolutely invited Mercy to be part of this. This is for
But they
everyone.
haven't taken you up on the offer yet, have they? They're not part of the Alliance yet.
They are not currently at the table, but that's the thing. This is made for easily scalable. It's made for growth. This is made for everyone. The Alliance is not any one thing. The Alliance is the Alliance. It's made to support this community and support this region. And that means we want everyone. Evangel is already an educational affiliate. We have some great, exciting news that we'll be excited to talk about at our groundbreaking in terms of growth and expansion and what that looks like. But it is for everyone. It's for every school system. It is for every workforce provider. we absolutely want them at the table, because that's how this works best. It's when everyone gets involved and everyone participates.
Yeah, you know, I mean, we have two great hospital systems here,
are
and
fortunate.
they compete, and in some ways that probably results in a better delivery of services.
Absolutely.
But sometimes you hope that you wouldn't have duplications.
Right. And, from my perspective, it's what I say this all the time. We need to collaborate when we educate, and then we need to compete for hire. That's better for the students. It's better for our community, because then we all get on board, do whatever we need to do to educate these students, but then free market prevails. Then students are going to have the opportunity to be kind of interviewing the various healthcare providers and making a decision about where they want to go. So that's the time whenever our workforce can compete to hire them, because that's just going to make those benefits and those environments better if they're doing that. But we collaborate to get there.
Well, I hope you can do a great sales job with that.
That's the thing. It's not sales. It's like, our baby's not ugly. This is
Everything sales. Everything sales in some way or another. What's this going to look like 5 years from now?
Oh, that's so funny. We were spending the entire day yesterday thinking about just that. So we spent the day strategic planning with our team and our operations council, and it was really exciting, because while we've done the impossible, we've done so much hard work together. I've been in this position for a little over a year at this point. They, before me, had been working for about a year and a half, and so now we are finally at the point where, okay, we're welcoming students on campus. We're ready to invite workforce affiliates, educational affiliates, all of those people in. We're ready. But what next? Because there's so many things we could do. What should we do to be the most effective for the community? So by 2030, we are going to be completely thriving. I believe that we will have our regional hub system up, and we will be producing more graduates than I think anybody had projected. But even beyond that, we're going to be continuing to push ourselves to think about, how do our pathways currently create new opportunity or improve opportunity for people. This is just as much about helping to make sure that our healthcare providers have the talent they need, but it's also about making our community better by helping people have opportunity to career paths and education that they did not feel they had opportunity to before.
One of the things that's in the news recently, and I don't know, maybe it just really doesn't affect what you're doing directly, but there's a lot of talk about Medicaid cuts. Mm-hmm. How does this affect what you folks are trying to do, if at all?
Oh, well, it complicates things for our providers, without a doubt. And so, we need strong healthcare providers. We need our hospitals strong.
A lot of rural hospitals may close.
We need rural hospitals.
Yeah.
And so it's, if anything, from our perspective, it is more important than ever that we make sure that those hospitals are not, especially rural health, that they are not dealing with workforce shortages that they can't overcome, along with potential funding problems. It's more important. We have to make sure that they are not draining energy and resources just trying to provide care whenever they're already going to have additional pressure, potentially from other outside influences. It is more important. We've got to get it done for them. We have to. And it's not just them. I don't mean them, because it's us too. There is no way you can separate any rural healthcare provider from the larger whole in Springfield. If they close, what happens? It puts more pressure on the providers in
Absolutely.
Springfield. So it is not something that, this entire thing is really interwoven. We have the solution. I would say, please stop making it harder from outside influences, but we can only do what we can do, and at this point, we're going to do our level best to make sure that we are supporting our healthcare providers, especially those in rural health, to take some of those challenges off their plate.
I've about taken up all of your time I feel comfortable with today, but before we conclude, is there anything that I haven't asked you about you'd like to tell us?
I think there are more questions that I would like to ask you, because I'm curious. We haven't had a chance to catch up, but I could talk about the Alliance for days and days and days. It really is my favorite subject. I have never been a part of something, and I've had the opportunity to work in healthcare, which I think is an eternally significant industry. This is in 2030, we're going to look back and say, wow, we did this, and this is going to be a model that people will replicate and will see across the board. So for anyone listening, and for you too, I hope, come see us on the 25th at 1. We're honored that the governor is going to be there and be making remarks, but really it's just going to be a celebration, very student-focused celebration with lots of surprises, and a celebration of community, a celebration of that area, which is really going to be an educational hub as we think about all of our educational partners that are there. And come be part of this, because it's not separate than, this is our community, this is our region, this is a celebration of what we do very best in terms of collaborating and working together to solve problems in unique ways, and we can feel proud that our region's the first, we're doing it. Everyone else is complaining about it, complaining about what they're going to do, and we're doing it.
You know, when I used to be on city council, I'd get this question from time to time. Why would you want to do that and listen to the complaining? And
I actually have that question. It's one of the ones I want to ask you.
But what I would say is, well, yeah, there's some of that. But when you're working with other people to try to make your community better, that's as good as it gets.
It is.
You
It
know?
really is. I mean, we're friends and neighbors here, and
that's as good as it gets.
it is. And we are lucky in that. That's why I think that it took the leaders in the roles that they were to forge this path, and then other communities will have the benefit of them being brave enough and trusting enough to do it, because we'll be able to say, okay,
'Cause
we've
you
done it,
planted
here's the
that seed.
playbook. And we'll be able to say, here's how to do it. So it's something really special.
Shallina Goodnight, thank you for being our guest today on In Our Town.
Thank you for having me.